Okay. Well, first, thank you for inviting me and QBD to give a little talk about MDR and the regulatory aspects in medical devices. And you asked me to dive into a little bit detail on the current trends. So we decided to choose digital health software as a medical device as a topic of the next 20 to 30 minutes. At the end, I also have a few slides on the implications of the MDR changes for distributors, but I think I can say that we are also planning for a follow-up webinar where I plan to dive into more detail on those implications, more the why MDR wants them and what they mean practically. So let's start with a short introduction of QBD, of course, since I guess most of you don't know us. Some figures. So we were founded in 2011. It's a Belgium-based company. This is our 10-year anniversary with offices in multiple countries like the Netherlands. I'm based in the Netherlands, in MDR. We have offices in Spain, Mexico. We have a QBD software daughter company who sells eQMS software. And we have offices also in Colombia and in France. Over 300 employees and plus 50 clients. What do we do? So we are active in the fields qualification and validation, qualification of equipment, processes, methods, software validation. Quality and regulatory, we assist companies, most often startups also, with technical files, regulatory filing, audits. We build QMSs, and we support in handling of CAPAs, NCs, etc. Clinical solutions, so together with Trium, a clinical solution provider, we perform clinical investigations, clinical evaluations, and consultancy work. Project management, so we can also execute complete projects within our customers' sites. Some of our clients are listed here. You will see, for instance, DSM, MSD are big clients of us. Pfizer, Janssen, we have a lot of people working there. Pharma, medical device sector, it's a combination of both. So Biocartis, for instance, for medical devices, Hubert de Bakker, Fluida. Something about myself. Vincent van Vulpen. I'm Dutch. I am a medical device QA and regulatory project manager, so to say. So I work on QMS implementation at our customers, helping them with certification, technical file writing, project management, and I also give trainings and these kind of presentations. Some of my customers I'm currently working for, Zigzag is a small startup in 3D printing. MDX Health is a little bit larger. They make in vitro diagnostic devices, and Oncom4 is a small company that works with virtual reality. So that's also actually quite innovative. That's an example of using software and virtual reality glasses for digital sedation. So I don't know if you can imagine that, but then you are on the table for surgery, and instead of getting medicines, you will be digitally sedated. That's what they do, and it works. So let's first talk a little bit about medical device and IVDs. So as you, I think, know, there is legislation on both medical devices and in vitro diagnostic medical devices. This is a very short snippet of the medical device regulation, or the medical device definition, I have to say. It's so a device that is intended by the manufacturer to be used for human beings for medical purposes. And then they have a few bullet points on certain types of use that belong to medical devices. IVD is a medical device that is used in vitro for the examination of specimens derived from the human body, solely or principally for the purpose of providing information. That includes specimen receptacles that are intended by the manufacturer to contain and preserve human specimen for in vitro diagnostic examination. So how does a medical device end up on the market or at you guys, at the distributors, in a nutshell? So the first thing a manufacturer will create in terms of regulatory, so I'm now focusing on the regulatory strategy, so to say, regulatory road to market. Yeah, the manufacturer has to build a technical file for the device. This technical file contains all the information on the design and development, the manufacturing, the labeling, safety studies, clinical studies that are done with the device. So it's a dossier that contains the evidence that the device is safe and effective. This dossier is then assessed for its conformity. So conformity with the MDR requirements or the IVDR requirements. This can be done either by a notified body, or it can be done by the manufacturer themselves if it is a class 1 low risk device. But nowadays more and more devices are shifting from class 1 to class 2A devices. So notified bodies will be involved. And so after the assessment of the notified body, and often there's also an on-site audit of the notified body to see the QMS and the manufacturing of the device. A CE certificate is issued if you pass all those inspections and reviews, and the manufacturer can place a CE mark on the device. So this is, in a nutshell, the regulatory go-to-market road of a medical device, I would say. Risk and intended use. So the risk related to the medical device eventually determines the amount of effort and evidences a manufacturer needs to provide in the technical file. So for EU, we have 4 classes, class 1, 2A, 2B, and 3. The FDA has different classification, but the principle is the same. The classes are linked to the risk of the devices, so meaning that higher class is a higher risk for the patient. And it's all based on the intended use and on the claims a manufacturer makes. So you can see there is a correlation between the claim and the risk. So for some examples, class 1, simple band-aid thermometers, also wheelchairs, sterile gloves. Low risk devices, class 2, can be syringes, sterile scalpels, but also birth control devices. Class 3 are then the high risk devices like implantable devices, pacemakers, prosthesis. And the manufacturer will, based on its intended use, based on its intended use, the manufacturer will classify the device and build the technical file related with the risk, and then the manufacturer has to do certain clinical studies, yes or no. So now we know the definitions of a medical device and an IVD. Let's now look at a special type of medical device software. So, as you maybe can imagine, that software does not really meet the common idea of a medical device like a wheelchair or a surgical instrument. But nowadays, software gets more and more advanced, and the AI aspects, they almost, well, they are starting to replace human thinking. With the old legislation, so the directive, there was not really a strong focus on software, but now the EU agrees that software needs some more attention, and they already wrote in the past some guidelines on how to handle software from a regulatory perspective, so classification and qualification of software. They say there are two types of software, integral and standalone software, and it's depending on the data that is used with the software, the input data, the software falls either under the medical device directive or regulation, or under the IVD regulation. Depends on the data that is used. And in our more platforms and devices are software that you might expect. I have some examples. So the first example is an algorithm that generates a risk score to trigger care processes based on respiratory rate, heart rate of a patient, blood pressure of a patient. So it's an algorithm, so you can see the link with AI now. It helps a healthcare professional to make a decision. It definitely has a medical purpose, and that is what is required to be defined as a medical device. It uses in vivo monitoring, so it uses in vivo data, patient data, and therefore it's classified as a medical device. So this software is a medical device. It could be that the software also uses this software also uses in vitro data, like blood sample data, urinary specimen data. But it's depending on the type of data that is decisive in the final, in the final purpose. What makes the decision as the biggest impact, the highest factor. That type of data will determine if it's a medical device or an in vitro diagnostic device. Second example is a bioinformatics that are intended to analyze sequencing data coming from patient cancer genomes. So here we have we use bioinformatics to allow detection of genome alteration, which supports diagnosis and treatment decisions in the end. And of course, it's this is also it's a very nice thing. So in this way, doctors can prevent unnecessary treatment with medicines or chemotherapy, and allow a more personalized medicine approach. That's the term. And the inputs of this bioinformatics is in vitro data. It's genome data. It's from a specimen DNA samples. So therefore, it's IVD input, and we can say this is an IVD medical device software. There is another type of software we call more generic. So for instance, software to be used for hospital staff planning and invoicing, which is used in a medical setting in a hospital, but it's also using patient data, but it's not with a diagnostic or a decision purpose. So it doesn't have a medical purpose. So therefore it's a generic type of software and does not fall under the medical device regulation. And there is a whole guideline written on this by the MDCG. Another more maybe practical example, innovative examples like a Fitbit device some of you may have or wear at the moment. It has a function that monitors your heart rate, but it's not a medical device because it's not intended for medical purposes. The manufacturer does not intend it to be used for medical purposes. You can use it for medical purposes if you want, but they mean to use it for just for fun, and therefore it's not a medical device, but they do explicitly mention that in their safety and product information that this product should not be used for diagnostic, preventing, or any other treatment purposes. On the other hand, we have also an Apple Watch. The Apple Watch itself also has a function that monitors the heart rhythm. It can do a little bit more than just the heart rate. It can also see the rhythm. And the Apple Watch itself is not a medical device. But the Apple Watch has an application, and that application that processes the data from the Apple Watch. So therefore, the application is medical device software, which now has FDA clearance. Downside is, for such a, well, commonly used by a lot of people, products, is that if you see this ECG app, you think, oh, that's nice, then it will prevent me from dying to a cardiac arrest or something like that. But Apple does place some disclaimers because they, of course, they tested the app and they saw that, yeah, it should only be used by persons above the age of 22 and only by healthy persons, because it's not proven to detect cardiac arrhythm in patients that already have a underlying condition. So I said misleading. Yeah, information is kind of key here to prevent, and that's also where healthcare professionals are afraid for, that people are now making decisions on their own based on these types of apps, because they trust that it's also for them applicable, but it's in fact only for persons above 22 and that are healthy. So information-wise, things can be improved. So that's for some software examples. Let's quickly look at the MDR, the transition and the changes. So as you all know, the MDR regulation enters into force May next month. It was postponed to May 2021 because of COVID. They wanted to prioritize the supply of medical devices that are needed, and to have the notified bodies available for that, and the competent authorities also, instead of having to focus on getting new devices approved for MDR. So for May, you have to comply with the MDR. Devices with a CE certificate that has been issued under the MDD, so directive, they are still valid until the date of expiry with a maximum of 2024, unless the device is changed significantly. So there's also some guidelines on what is then a significant change. But until 2024, these MDD devices can still be manufactured and sold. And after 2024, you have, I think, 1 year that all the devices that are already sold, that they can still also be distributed. But there is not allowed to produce new devices under the MDD certification. However, imagine you have a lot of MDD certified products, and you think, oh, then I have 2 more years to comply with MDR, or 3 more years. That's not true, because from 26th of May 2021, you do have to comply with the MDR requirements for post-market surveillance, vigilance, registration in EUDAMED, and the market surveillance. So those all come into force. Let's talk about changes of the MDR. Most of them are applicable for manufacturers, of course, but there are also some new obligations for the distributors. I will come back to that. In general, I would say clinical evidence is quite key. So there's more focus on providing clinical evidence for devices. Post-market surveillance becomes more crucial. That is leaning towards the medicinal products, pharmacovigilance. It's becoming more and more similar. The labeling, of course, changed with introduction of the UDI, and up classification is also a possibility that your device was class 1 under the MDD and is now class 2 or class. Well, I don't think a class 1 will be class 3, but a class 2A it could be. Well, for software, exceptions are certainly true. We will see that in the end. So that is, and let me make a pointer, what I said, labeling, UDI. I have a slide. Yeah, reclassification, more involvement of notified bodies for sterile and measuring class 1 devices. Instead of just a self-certification, they will require an assessment of a notified body before being approved on the market. PRRC is a new role for manufacturers. It's a person responsible for regulatory compliance that they need to appoint in their organizations. Yeah, let's go into a little bit more detail on the following slides. So UDI, unique code for each product. We have the UDI DI, which is the device identifier. So every device has its unique UDI DI. And after production, a UDI DI is extended with the UDI PI, which is specific for the production of that batch of medical devices. We have UDAMED, which with every government IT system is not yet completely ready, partly postponed. So the actor module is now ready. You can register as an actor, so distributors can register, manufacturers can register, importers can register. And I think the UDI module is postponed to September this year. They try to make it together with the implementation date of May, but they did not make that. Classification changes. Yeah, so classifications. Now I want to point out a new rule, a new classification rule for standalone software. So in general, software shall now fall within the same class as the device. If it is software that is integral to the device, if the software is independent of any other device, so it can be used with it's more like a universal software or platform software. It's standalone, then it shall be classified in its own right. And to show more about that, so I said here, rule 11, it's all about intended purpose. So with software rule 11, class 1 is now an exception. With the MDD, most software was class 1, but now class 1 is the exception. So if the software is to provide information for decisions with diagnosis or therapeutic purposes, it's already a class 2A software. And if the software is diagnosing or giving therapeutic advice which may lead to death or irreversible deterioration, it's already a class 3, so the highest class. And that is quite a rule with a lot of impact, I would say. meaning that a lot of software that used to be class 1, so self-certification has a high chance of being upregulated to class 2A or class 3. And that means that certification. So for instance, if you have this algorithm that performs selection and dose calculation of chemotherapy, that was first a class 1, because yeah, it's not directly harmful to a patient because it's software. There is also always a doctor, but now the intended purpose of this software is such of a high risk that it will be a class 3, because the outcome of the algorithm, of the calculation, could be life-threatening, so to say, or could decide which chemotherapy makes the patient survive, yes or no. So what does that mean if now certainly your software that you supply is class 3, then the manufacturer will have to provide more clinical evidence, need to implement a certified quality management system. Notified body will come to check all the documentation on the software, the validation, the clinical evaluation, etc., etc. UDI, I guess most of you know it, so it's meant for traceability, a unique device identifier per batch, per device, to really focus on the traceability. And also the distributors will have to check if devices have an UDI on their label. IntMeDA, yeah, so IntMeDA is composed of multiple databases, modules, and it has some mandatory inputs for notified bodies, manufacturers, and competent authorities that put data in there. It's partly publicly, but there are different levels of access. Also, traceability is key here, and every economic operator gets a single registration number. That's the first step. Final slide, few key MDR changes as I see them. So more responsibilities and obligations for distributors. Distributors have to make sure devices distributed are compliant with the MDR. No, that's not really true. Make sure devices. Yeah, that the labeling, the documentation is compliant with MDR, but needs to be supplied with the device. Verify that devices have been CE marked with correct documents and labeling. That's the sentence I put there. More emphasis on storage conditions in general. Obligation to notify manufacturer and authorities in case of, well, possible suspicious issues with medical devices. So more control there, more liability, I would say. And they need to keep a register of complaints and non-conformities that they get with the device. And they need to be more open to cooperation with authorities. And so this is just, for me, a simple list. I hope to give you more detail and context in the next webinar. That's my intent. So that was it. I hope I was a little bit over time. I see 14:33, but I would say if you have any questions, please let me know. Or what's your plan, Christoph?
Sure, we have time for a few questions.
Good.
Thank you, Vincent. This is Yuri. Thanks for the very clear overview, very practical. Just a question regarding your company, specifically to the introduction of digital tools for psychiatry, patient treatment. Are you in this field of helping to access the market? We've got a couple of the projects there, and we're looking for the regulatory partners to get us through European markets.
Psychiatric therapeutics.
Devices which will be collecting the data to treat schizophrenia and dementia patients.
Yeah. Not that I know of that we are
Okay, fair enough.
ahead, but like I said, the first example I gave with the virtual reality, that's also such a, for me, that's similar, because they are also wanting to capture ECG data from patients, and it's also based on the environmental virtual world. So it's a little bit psychology, I would say.
You know what? I'll take it offline and I'll drop you email with specification, and we see what comes out of it.
You can always drop me email. I will get you in contact with our guys who know everything we do, because we have a lot of projects, a lot of clients. So I do not know by heart every project and every client we work for. No, sorry.
Love it. Thank you.
Vincent,
Thank you, Vincent.
This is Roel Klaassen. I've got a question. We have a lot of partners, other wholesalers, customers asking for all kinds of information regarding the new MDR. So they're asking for CE certificates, certificate of origin, UDI numbers, things like that. Do you think that this kind of information will become available in IntMeDA? Because now we have the request of information is going down the chain towards the manufacturer, while everything is being registered in IntMeDA in the end.
I know certain type of information will be publicly available, like this UDI, DI, but I don't think everything will be available, because some documents just need to be supplied with the product. So then it's not sufficient to just get them via IntMeDA, but you really need to supply them with the product as a manufacturer. But I don't know what information is in IntMeDA, but I know a lot is publicly available, yes. So once that is all live, and we know the specifics there, yeah.
It's planned by the end of the year, you said, yeah, right?
Yeah, September, yeah.
Okay, we'll see.
Yeah, because if you register a device with in the UDI module, you need to deliver a lot of information, but they don't say which information will be publicly available in the end.
Okay. Okay, thank you.
Olivier?
These registrations within IntMeDA, is this on the supplier / manufacturer's responsibilities or on the distributor's responsibilities?
If the manufacturer is based in the EU, they should register in IntMeDA. Otherwise, it should be the authorized representative. And if you are an importer of medical devices, you also have an obligation that you need to register in IntMeDA that you are importer of those medical devices. But for distributors,
But as long as there's like an authorized representative, this should be covered, I guess.
Unless you are really an importer of devices from outside of the EU, then you need to definitely need to register something in IntMeDA. Yeah.
Thank you. That's clear.
You need, one of the obligations that you need to check as a distributor if the manufacturer has an authorized representative. So then you are certain that the authorized representative should register the device in IntMeDA, and you avoid the risk of having unregistered products in distribution. Yeah.
Thank you.
All right, we got time for one last question, guys.
Yeah, nice questions.
Well, I have a last question then, Vincent. What about the trend in the big corporations coming into the medtech? Because since I know that in the report of investors, for example, Apple and definitely Fitbit and also Garmin and all those are struggling and fighting other medical device technologies and companies on the battlefield of the, well, basically the ECG, but they are, they are proceeding further. And what is the point of view of the European Commission and also of the MDR on this sector? Because as you said, they are now battling that with disclaimers. But what is the future development in your opinion?
Good question. And I think I have the feeling Europe does not really know themselves. The focus is now, yeah, I don't see really a lot of focus on consumer goods, because they are consumer goods that are used for medical purposes. And yeah, how I see it, like I said, information to inform the people who buy these applications, how they should use them and how they should not use them. That's the only thing you can do right now. But you are now on the fields between a medical device and a toy, so it's clashing a little bit with each other. Yeah, so it's difficult.
Right, thank you.
That's a little bit your question.
Yeah, right. Yeah, it was a tough question, even for the legislators, right?
Okay, good. Thank you.
Okay, thank you. Any last questions, or are we ready for our afternoon coffee?
Oh, it was great. Very efficient, to the point. So thank you very much, Vincent, and thanks, guys, for participating.
Thank
you, everybody.
Thank you.
Well,
Have a good day.
Thank you.
Bye-bye.
Bye.
Bye-bye. Have a good day.
Bye-bye. Thank you, Vincent.
Thank you. Okay.
We will be in touch, Vincent, with some follow-up, just basic recap details, and I will send you the link as well if you want.
Okay, good.
Recording. Beautiful day, Vincent. Have a nice day. Bye-bye.
Have a nice day, guys. Have a nice day. Bye-bye.